It's really deep tissue massage. That's the way I see it. It works in groups of sessions and it works with the whole body. If you're someone that really likes deep tissue massage, this is definitely for you. Hello everyone, Dr. David Kulla here with Synergy Wellness in New York City. I'm covering myself up because I don't usually feel, I'm not usually on camera this bare, but today I'm going to show you Rolfing. So we've got William, our massage therapist, Rolfologist. Do you call it a Rolfologist? Rolfer.
Oh, yeah.
Okay,
Yeah.
So he is a Rolfer, and for those of you that don't know what Rolfing is, you can certainly go to our website or his website. I'll leave that down below in the description, and you can read up a little bit more about Rolfing, but I'm going to tell you basically what Rolfing is, and then he's going to elaborate on that. So to me, and to most of you, Rolfing probably is really, really deep tissue massage. Some people say it brings tears to your eyes. I've already had one Rolfing session with William. He is our in-house Rolfer and massage therapist, so he's going to describe Rolfing a little bit better, but it's really deep tissue massage. That's the way I see it. It works in groups of sessions and it works with the whole body, usually from the ground up, correct?
It's from a variety of vectors. We balance the structure.
Okay.
So the goal of Rolfing is to balance the body in the most powerful force that we are in, which is gravity. So we look at where gravity flows through the body and where it's impeded or inefficiently traveling, we make it flow more smoothly. And by kind of having this broad perspective and not looking specifically at each anatomical problem, we can sometimes see patterns that are harder to look at when you're focusing on individual situations in the body. So by working in this broad perspective, we are successful in balancing the body, and then often the individual problems that people are complaining about or are struggling with start to dissolve because the structure as a whole is more balanced and efficient.
Mm-hmm. Very similar to the way chiropractic works. Okay.
Similar. The difference really is the sort of historical focus that chiropractic tends to historically be focused on the bones, and Rolfing Rolfing is focused more on the connective tissue.
Soft tissue.
But of course, the modern definition of connective tissue includes bone. So the difference here is it becomes a matter of a philosophical discussion, right? So
sure, and he's right. Chiropractors focus on the joints, not just spinal joints. As some of you have seen my videos, I do shoulders, elbows, wrist joints. Any joint, really, for that matter, can be adjusted or manipulated if it needs to be. But the key with the spine is it's the nervous system, and it's balancing out your sympathetic and your parasympathetic nervous system. But those nerves in the spine also go to the muscles and control the muscles. So I'm getting some Rolfing done for myself. For those of you that don't know, I had scoliosis as a kid, and I had my scoliosis straightened. And then after my spine was straightened, I fell down the stairs and I broke my back. And this is something I haven't mentioned on on YouTube. But my vertebra at T10, T11, and T12 in my lower thoracic region and upper lumbar, I have 3 compression fractures. So instead of my vertebra being like this, they're pancaked. So what that does is it brings my ribs very close together. And I'm going to show you pre and then in 10 visits after all our Rolfing sessions how my ribs are going to start to shift and change place. But right now, my rib on the right side is higher. And on another video, I'll show you it. But again, my ribs are really close together here because of the compression fractures. And also, I had a couple of rib fractures on those same exact ribs. So this session he's going to work on the lower part because it's only my second session. Okay, both. You guys are going to follow me hopefully through all 10 sessions of Rolfing so you can see what it's like. Okay? All right, go ahead.
So,
Get started.
just one thing, if we were still recording,
Yep.
is to say that the way we'll work with the ribs that you were talking about and the vertebra that have been compromised by those accidents is by easing the sort of tensional web that they live in, because bones are where they are because they're surrounded by tissue, and the tissue places them in part. So by easing, smoothing, softening, enhancing the comfort and efficiency of that tissue, then those bones can separate more, and all the neural functions are eased because the environment has less duress, less constriction.
Mm-hmm.
So that's our goal. So basically, I'm gonna just spend some time here on your lower leg and your feet.
Okay.
And you can just sort of slowly, reach down with your heel in this direction, sort of like you're stretching through the middle
Okay.
of your leg with your bones. It's not that you're and relax here a little bit. It's a way of kind of making the stretch deeper. If you imagine yourself pushing your bones through your flesh in this direction towards the center of the room.
Okay. And if anybody's wondering, my first session, it was really deep tissue, but was it painful? No, it was therapeutically sore, I guess would be the best way to describe this for any of you that have never had Rolfing, or if you're curious about Rolfing, but you tend to not do well with deep tissue massage. If you're someone that really likes deep tissue massage, this is definitely for you.
And the depth is really there's no if you push too hard on somebody's body, you know that from just your own experience, your body's going to stiffen up and react.
Resist, yes.
So that if you have to kind of find that sweet spot where you've got some stimulus, but not so much that it causes the body to recoil.
Absolutely, yeah. Finding that right mixture, and that's probably not easy for you. You have to change it up patient to patient, just like I do as well.
Right.
Yeah. The adjustment mixed with this work is perfect.
Here, just flex your wrist a little bit. I'm doing that just to lengthen the tissue I'm working on. I'll often position someone in a way so you see if I had working with them like this and start pushing here, it's going to create just a little bit of constriction in this part of his wrist, which I don't want to do. So I'm just turning. You don't have to work with it. Just by positioning your hand that way, it just adds that length to the tissue.
I almost feel it more on this elbow than the other one. lot of tennis elbow in here. It's an annoying injury because sometimes when it's bad, you can't even hold your cell phone up. You can't even hold a drink in your hand.
Oh, yeah,
So we've seen some bad cases, and if you get it in both elbows, it's not fun. Even to the point where you sleep at night, you can't even sleep with your elbow bent because you'll wake up and you won't even be able to open your arm up in some cases. So if you have lateral elbow or medial elbow pain, get that addressed right away. So, William, could you tell everybody, typically you do 10 sessions. The first session is sort of the whole body, right?
Introduction, yeah.
Introduction. Then the second, see how people tolerate it.
Well, the second session, we're working on building support for the pelvis, which is the biggest, structure in the body.
Okay, which is the lower from the hips down,
yeah,
correct?
Yeah.
Okay.
And so we're working on building a more balanced support. So obviously, if your feet are askew, then it's going to be harder for you to have a flexible and horizontal foundation for the rest of your body. So that's why we focus on this area early.
Yeah. I'm a big proponent of that. For those of you that don't know, and if you've seen our videos, right over there in the corner, we have a foot scanner, and that reads the arches in your feet. So if you're flat-footed, you're going to rotate your knees in on both sides, and your hips are going to tilt forward if you're flat-footed. So gait, feet are everything, and everything from above the feet adapt to the way your feet are. So
yeah, everything's in relationship to everything else. So
it's a kinetic chain.
Come on, lie on your right side here for a little bit. And just come back this way towards me, just a tad. Not too good. And I'm gonna just position your legs like this a little bit, just to kind of ease that way.
Okay.
And what I'm doing is just putting him in the position where he doesn't have to do anything. Like he doesn't have to push back, or it's like if I push on him, he doesn't feel like he has to push back to keep from falling off the table. So that's why I put his knee up. If I go like this, he doesn't have to do anything. He's not going anywhere.
Okay, so session 2 you would say would be lower below the pelvis, the legs.
Well,
Session.
that is a focus. That's the primary focus. But you want to connect what you've done to the upper part of the body, which is why I'm working here now, just so that neurologically and in terms of tissue, the body can. If let's say your rib cage is really stiff, and you do this nice job of releasing someone's legs and lower feet, that stiffness in the upper body will diminish the benefit in the feet because of the relationship between everything in the body. So you want to work a little bit everywhere in each session and focus on something that needs progression.
Okay. For some of you, may notice that like when you get a massage, that one side is, maybe both sides are tight, but one side just isn't sore, whereas the other side is very sore. It's very common to see that. That has to do with chronic tissue damage, soft tissue damage. The cells lay down metabolic waste, and that causes inflammation, substance P, lactic acid in the muscle tissue, which in turn causes pain. So for me, I don't get really
or scarring.
Scar tissue. Yep. I don't get any soreness or symptoms on my left side. Very rare. Although about a month or two ago, I did have a little bit of tension there on my left side, which was extremely rare for me. Always, though, I get from all my accidents and my rib fractures and my scoliosis, I always get some soreness in my right QL, quadratus lumborum, and multifidus muscles. So it's common to see that only on one side versus the other, to see soreness, or to see soreness in the muscles in the lower back on one side and then in the shoulder on the opposite side. That's common. So if you get a lot of like lower back
tension or tightness or pain on the lower right, for example, and then you notice you get a lot of neck and shoulder pain on the left, that is an indicator that you may have scoliosis. You could have just a mild case, but that's a good indicator that you may have that. And it's common to see opposite lower back and opposite shoulder pain.
And most of us have some curve in the spine. It's not when it becomes pathology is
Over 10 degrees.
Yeah, and it's also it just depends. You know, it depends on whether some people can have a lot of scoliosis and be comfortable. Just they've adjusted or balanced their body in some way. So I'm
They've
just saying,
sort of adapted.
Right. If somebody tells to you that if just out of the blue that you've got scoliosis, that's not a death sentence. It just means that there's some curve.
Absolutely.
And it can be eased, and it can be
Obviously, the more severe the curve,
the more difficult.
The more usually, and the more symptomatic usually the patient. And oftentimes people are asymptomatic in the beginning with scoliosis, but when they get into their 40s or 50s or 60s, that's when they start developing problems. I'm lucky I had my scoliosis straightened and mine was well over 10 degrees. But I'm one of the lucky ones.
My approach to things is, I'm not saying this rib needs to be there or that rib needs to be there. I'm looking at the broad wrappings of tissue that are holding the ribs in place. And in the early stages of the Rolfing, this is only the second session, I'm focusing on just opening up these broader structures so that everything has more room, is more free. And if there's an individual anomaly, that usually kind of starts to show itself later when it's a place that's hanging on, where other things have released or something like that, and then we can get a little more specific. But we don't really need to do that yet. Sometimes, when something is, by the way, if someone's in pain, if something is really rigid and someone's in pain, soreness is on the road to recovery. You want it to be sore. Yeah. It almost has to be sore in order to get comfortable. It goes from pain to sore to comfortable, at least with this kind of work. How do things feel on this side here, this hip? It doesn't feel.
I had I remember I was telling you I get a little sacroiliac inflammation on the right side in the last 9 months since coronavirus. It's really the QLs that are sore on that right side.
Right in here. Again, I'm not trying to reach in and take a salad fork that's in the wrong slot and put it with with the steak knives or something like that. What I'm doing is just creating a vector of force, and then his body organizes itself around it.
I could see how this would be really great work leading up to a Ironman triathlon, which I'll be doing one next year. Actually, this coming summer I'll probably be doing a couple of half Ironmans, and next year for my 50th, oh, I just gave away my age, I'll be doing a full Ironman. I could see how this would be great for 10 weeks leading up to the race.
Right. Yeah, you wouldn't want to. You want to give yourself a little time right before it to just, you wouldn't want to get work right before the race. But
No, like what? Maybe a couple days before.
yeah, or a week or so, just so you're not adjusting to any intervention.
Yeah, and I wouldn't recommend just doing one session a week before your triathlon. You don't know how you're going to respond that first session. It should at least be done 2 to 3 months before your actual race date, so you can see how you acclimate to it, respond to it without any adverse reactions. And
Oh, by the way, most people do the sessions either once a week or once every other week. In the series of 10 sessions. There's 10 sessions in the basic Rolfing series.
Okay.
Which is what we're doing here.
Okay.
Let me flip you over again so I can just give you the same touch over here to your left leg. And again, I'm not pushing, I'm really just leaning. So that's
Feels good though.
And just feel the difference. Like I'm gonna push as opposed to lean. It's a different, even though it's less energy, it often feels kind of more disturbing. Than
Yeah, I think it's more. It feels more deep than.
I do is sort of see how if I look at his body lying now on the table and his belly's kind of settled a little bit, which tells me that things have lengthened a little bit in the lower back. And it's just I assume you feel that a little more contact with your lower back to the table, which is just indicative of that. Just bring this knee up for a sec. Yeah.
So I hope for you folks, this kind of gives you a better idea of what Rolfing is. A lot of massage therapists do not do Rolfing. It's a specific training, hours and hours of training and specific technique. For the history of Rolfing, and again, you can go to his website or ours. I'll leave that below. If you want to kind of get into the more specifics of who and when it was developed and why. And
yes, Dr. Ida Rolf developed it in the 1940s here in New York City. She was a New Yorker, actually.
Okay.
And you can go to www.rolf.org.
Okay. Rolf.org to learn about
ROLF. Yeah.
Okay. You'll be here what days a week?
Yeah.
Yeah.
Tapes over, yes.
Well, he'll be here 3 days a week. So, if any of you wanted to ever try Rolfing or make an appointment, you'll be able to do that online and see his availability online on our website. Ooh, that one is sensitive.
Okay, all right, I'll move this around a little bit this way. More laterally. Is that easier?
It's easier, yes.
Okay.
But you don't have to go around it just to
Yeah,
make
well,
it
I
easier.
didn't want to compress it directly. It's like
Gotcha.
pushing
This
heat.
tends to be the sensitive iliacus, and
Right.
anyway. A little bit more.
Come and have a seat here, David.
Okay.
And yeah, that looks about right, I guess.
You need me lower, or?
Maybe, yeah, just so you can rest on your knees. That's good. And yeah, bring your knees slightly closer together just to get a better platform for your upper body so you can rest on your knees. And,
Okay.
and just head over and rest on your knees. Just turn your head either way there, just to the left or right. This gives you a little extra length in your spine. When we go down your back here. And again, I'm working slow enough so his body can make use of this intervention, you know, in a sense of the gravity, the pressure, the stretch, however you want to describe it. But his body, if I go slowly, then his body says, oh, gee whiz, let me adjust to this. Let me make use of this new situation, which obviously isn't a threat. Let's see what I can do with it. I'm sort of giving words to the individual nerves and the muscles and around the back. So that's why Rolfing takes a while. It takes an hour or so.
What he's doing right now is elongating my spine and really stripping and stretching out the iliocostalis muscles amongst other ones, erector spinae muscles, for the most part, those two muscles, right?
Yeah, and the broad sheets of connective tissue that surround the ribs.
Mm-hmm.
You know, just going back up. Come and lie on your back again. You know, I sometimes, when I'm talking to my clients, I sometimes use just the image of the metaphor of a big piece of fabric or a body stocking or just a garment. You know, just like my shirt. You know, I can pull over here on the bottom of my shirt and things are moving all over the place. So, because there are broad structures, big structures that are linked, and even, you know, and all structures in a sense in the body are linked, because nothing, you don't, when you look at an anatomy chart, there aren't little walls or lines that separate things.
Yeah.
You know, one muscle flows into the tendons of the next. So, you can, like, for instance, I mean, I can, in some ways, affect his feet by just releasing the back of his neck, and vice versa.
And he is also certified in Upledger's craniosacral technique, right?
Yeah.
So that's a really great technique for cranial problems and sacral problems, and William is certified in Upledger technique.
Which I integrate into the Rolfing. I don't do that separately. It's just an enhancement.
And by the way, I fell and hit my head 4 years ago right here at the corner of my head on a corner of a desk, and I knocked myself unconscious.
Oh, wow. Oh, you told me
I
about
fell
that.
backwards, hit my head.
It was here in your
complete-
office, right?
Yeah,
Yeah.
knocked myself unconscious. I cracked a few ribs, all here in the office. Right after my mother had passed away in 2016. And that set off a cascade of problems for me. I herniated every disc in my neck, and I started to have migraines. Now, chiropractic helped me with the headaches and the neck pain, but only about 70%, I would say. And then I was still having these migraines. So I had some cranial work done and some cold laser, and that's what really helped me get rid of the headaches. I no longer get the headaches at all. And I was never a headache sufferer before that concussion, before that fall. So we're kind of concluding the Rolfing session here with some upper body, cervical and shoulder stuff. And that kind of gives you an idea of a Rolfing session. So I just want to stop here and thank you everybody for tuning in. And make sure you check out our next session. See you soon.